Hello, and welcome to the AVA Academy, where we strive to protect the patient, educate the clinician, and save the line. The Association for Vascular Access, in tandem with the Pediatric Special Interest Group, PDSIG, welcome you. This video depicts the proper technique for setting up a sterile field, donning a sterile gown, and putting on sterile gloves using a closed gloving technique. As with everything in healthcare, it all begins with proper hand hygiene. Once we've performed hand hygiene, it's time to start setting up our sterile field. Using a hospital-approved disinfectant, clean the Mayo stand or bedside table you plan to use for your sterile field. The surface must be dry prior to the start of placing items. Inspect each wrapper of your sterile items to ensure they are sealed and dry. Confirm that all expiration dates are in the future. If you have not done so before, now's the time to make sure you have a hat and mask on to ensure no hair falls on your field nor any respiratory secretions. Make sure as you open sterile items to only touch the outside wrapper and not the sterile contents within. Remember, there's no reaching over a sterile field, so any items you might need, put them just to the left or the right of you. Opening a sterile kit always starts with hand hygiene and a disinfected work area. As you begin, turn the kit so the flap opens away from your body. Open the sides, and then lastly, the flap coming towards you. Remember that the outer 1 inch of a sterile field is not considered sterile. It should be no lower than your waist, and never turn your back on it. You'll notice our clinician opened her sterile field with the last flap coming towards her. As the clinician is dropping items on the sterile field, she's focusing on putting the items in the middle of the field and not contaminating items by getting too close. She's dropping items near the center of the field in an effort to avoid items falling off and landing on the floor, thus becoming contaminated. Intentionally, the last 2 items she places on her sterile field are her gloves and her sterile gown, as those are the first she'll be using. It is recommended to repeat hand hygiene between procedure setup and donning sterile attire. Best practice dictates an assistant when donning a sterile gown. Notice the care and precision she takes while reaching for her sterile gown, as not to contaminate anything else on her field. As she puts her arms in the sleeves, she keeps them within her peripheral vision. Her assistant will now Velcro and tie her gown. Closed gloving is the recommended technique for applying sterile gloves. Pay close attention to the clinician's hands. They never pass the cuff of her gown prior to donning her sterile gloves. As she opens up the packaging, her hands stay inside the gown, and she uses them somewhat like mittens. Using her thumb and index finger on her left and right hands, she grabs the edge of the cuff and pulls it up and over her hand. Oftentimes, she'll need to pull the gown out of her glove to enable her fingers to get into the glove. Notice her left hand. Her hand stayed inside her gown. Now she's placing her left glove on. Again, pulling her gown just a bit to be able to get her fingers into the digits of the glove. Pay close attention to make sure that your glove completely covers the cuff, as the cuff is absorbent. Your assistant must grab only the purple section of the tag, and the clinician only the white section. There is an opportunity to contaminate in this exchange. Be careful. The clinician spins in a counter-clockwise motion as the assistant stays stationary. The clinician grabs onto the tie cord firmly and reminds the assistant to hold tightly onto the card as the clinician pulls the tie away from the card. Every clinician has their own unique way of setting up a sterile field. The takeaway is to have a routine. A consistent, repeatable routine ensures all add-on devices are dropped on your sterile field. Dressing, securement devices, injection caps, tissue adhesive, probe covers, and the like. These are all necessary for what we do. Notice the clinician drawing up lidocaine. She checks the expiration date, and then using the ampule breaker and packaging provided, she breaks the lidocaine ampule. Use the filter needle provided to pull up the lidocaine, as not to bring shards into the syringe. All filled syringes are required to be labeled for patient safety. Use the sticker provided. Always flush the catheter prior to starting the procedure. This ensures the catheter is patent, the wire will move smoothly, and no air is injected into the bloodstream. In this procedure, the clinician has already measured and has determined the length of catheter she'll need. Remove the stylet from the catheter prior to trimming to ensure you don't cut the wire. Remember, any item on your sterile field that drops below the level of your waist or the level of your sterile field is no longer considered sterile. Keep all wires and the catheter within the kit that it came in to make sure they're contained at all times. This video shows just one version of sterile setup, gowning, and gloving. There are other acceptable ways to perform each of these. Tune back in for complementary videos in this series that will highlight alternate options. The Board of Directors and staff at AVA hope you've enjoyed this program. We value your feedback. Please let us know what you liked, what you didn't like, and what you'd like to see in the future. Our email address is ava@avainfo.org. That's ava@avainfo.org. New videos are in production now, so tune back in often. To learn more about AVA, visit our website at avainfo.org. That's avainfo.org. Follow us on Twitter at ISaveThatLine. You can search for us on Facebook. We're under the Association for Vascular Access. We would love for you to check out our podcast. They can be found on Spotify and iTunes. Search for I Save That Podcast. The production of this video is made possible by the collaborative support of the folks at Valley Children's Hospital, the vascular access specialists, specifically Kim Sutters and Sabrina Doherty, the marketing and communications team, and all the staff, the patients, and the families of the folks at Valley Children's. Thank you so much. We couldn't do it without you. This video is the property of the Association for Vascular Access and is meant for educational purposes only. No part of this video may be reproduced, transmitted, or sold in whole, in part, or in any form without the express written consent of the Association for Vascular Access. Any use of this video or any pictures, descriptions, or accounts of this video without AVA's consent is strictly prohibited.